Okay, so first thing I did is I looked at the root of the question, so that last sentence, which of the following is the most likely diagnosis. And then I quickly just glanced at the answers, and it seems like this is some sort of derm question very
Okay.
quickly. Then I went back, then I'm going back up right now, going, okay, 5-year-old boy brought to the pediatrician by his mother, who's concerned about a persistent rash. Okay, so now we have a rash. Physical exam, erythemus, which is this red, pruritic, itchy patches with like the lichen, so like lichenification, if I'm saying that correctly, and exciserations on the flexural surface. So it must be like on his flexor's side as opposed to the extensor side
Okay.
on the arms. Mother reports the child rash worsens during winter months, improves in the summer. History of asthma and seasonal allergies. Then, which is the following most likely diagnosis? Okay. So now what I would go through is I would like start crossing off answers and be like, okay, it can't be this because. Um, so I'll start at the bottom. So, uh, ringworm, tinea corpus. I've had ring. I wrestled a lot. I did a lot of sports like that. That this is not ringworm at all. So ringworm is going to be usually one spot. It's not going to be. It seems like it's on both arms and legs. So I'd assume it's a little more than just like focal. I would not pick that. Seborrheic dermatitis. I'm not sure exactly that definition, except I mean, I usually see that I think we've been seeing that in like older patients and stuff, so I'm not sure about that one. Psoriasis, the only thing that makes me think maybe psoriasis is the lichenification. Um, and then he does have like this asthma, seasonal allergies. But psoriasis to me is usually like more of an autoimmune issue. Contact dermatitis would be like if you have like poison ivy, poison oak, sumac, something like that. That doesn't seem to be something that would flex with season. I would take that out. Um, and then so now I'm like down to like atopic dermatitis, which I like. That can be itchy. That can be on this patient of a 5-year-old boy. Can definitely have atopic dermatitis. Also, the connection with asthma, connection with allergies. That's lining up the most. I don't know about flexor versus like other versus extensor surfaces, but seborrheic dermatitis, if I remember, is like one of them is like waxy, or that's the one that looks like black. I can't.
Okay.
I'm just trying to think of those pictures. And then psoriasis, I don't. It's almost like too young of a patient, although I'm sure it's possible. But usually, I think like knees and elbows.
Okay.
So maybe that would be like more like extensor surfaces. Now that I talk about it out loud, so yeah, I'd go atopic derm.
All right. So which one are you going to go with? A?
I would go with atopic derm for this. Yeah.
Bingo. Okay. So this is, I think you worked through it pretty good and you had good explanations. I want to do a couple tweaks here. Okay. And
Okay.
so you kind of understand kind of how my thought process a little bit. Okay. So which of the following is most likely diagnosis, right? So you know it's the diagnosis question. You're
Is
digging
that
that
you did
in.
this? You did that too, right? You went first to
Yep.
there. You went like okay, okay. Just making sure.
Okay. Which of the following is most likely to diagnose it? So you in your mind, you're like, oh, it's a diagnosis question. Okay. I skimmed through it. You want to tell yourself, okay, this is a dermatology question, right? Very obvious from the
Yep.
answer choices.
Mm-hmm.
Okay. Now you're going to read the case, highlight things that are important. 5-year-old boy, pediatrician,
Mm-hmm.
concerned about a persistent rash on the son's arms and legs. Physical exam, right, shows erythematous, perpidic, so itchy lichenification. Excoriations
Mm-hmm.
just means like scratch like, right? Abrasions, right?
Okay.
The flexural surfaces. Rash worsens in the winter and improves in the summer. So you know it's seasonal, right? So you know it
Okay.
has to be affected by the environment. That's what I'm thinking in my head, right? Also,
Okay.
the child has asthma and seasonal allergies. So that's called atopy, right? Meaning that
Mm-hmm.
diseases that deal with allergies, right? So in my
Mm-hmm.
mind, right, I'm already thinking, okay, this is highly supportive of contact dermatitis. I mean, not contact, atopic dermatitis or eczema,
Mm-hmm.
right? So in my mind, I'm
Mm-hmm.
already thinking, okay, my gut should already be A. Okay. I want you to start thinking to yourself, try your best to come up with a diagnosis first. Okay. Sometimes what
So with looking at the answers or without, like what?
yeah, so I'm gonna say just in general for all questions, right? Because this is a diagnosis question. So in theory,
Okay.
right, your answer in your head should match an answer choice. But let's say it's a
Okay.
second order question, right? And a second order question would be like, oh, what is the mechanism of this diagnosis? So you would have to come up
Right.
with the diagnosis and then match that diagnosis with your answer choice, right? So the
Okay.
reason why I say do that is because if you are crossing out things, right, you have a chance of causing yourself to talk yourself into a question versus right. So you
Okay.
yourself want to come up with a diagnosis initially. Does that make sense?
Yes.
Okay, so you have a small form of what I call working backwards. Okay, a very
Okay.
small form of it. Working backwards meaning that you're looking at the answer choice and asking yourself, does this answer choice match the question? Okay,
Yes.
which is
I do that.
not that's kind of working backwards. My analogy is like if you're doing a maze, right, on a piece of paper and you start from the finish line. Okay. You want to
Okay.
always start from the beginning, right? And the beginning, I would always say, is based on this case, you should be thinking to yourself, okay, what is the diagnosis first? And then you want to match that answer to your diagnosis that you already came up with, not the reverse.
Okay. Okay.
And the reason why, like I said, is sometimes what will happen is you'll talk yourself, or what I call like your brain will make up things that is not true and say, oh yeah, I kind of remember something about this that
Hmm.
might fit this, right?
Okay.
So then you
I
might
agree with
pick,
you.
yeah, pick a answer choice that is wrong, and then it's going to be very hard to convince your brain otherwise. So always start forward. But
Okay.
other than that, your explanations are very good. Tinea corpus, right? Fungal
Hmm.
infection, right? Seborrheic dermatitis,
Yes.
right? I think those are kind of the waxy kind of things, right? Inflammatory
Hmm.
skin, high density sebaceous glands, scalp, face, upper trunk, erythematous,
Yeah. All I
greasy
remembered
skin.
was waxy with that because the
Exactly,
words were
exactly,
similar.
but not associated with asthma, seasonal allergy, psoriasis. You said this really really well. Ciliary plaques, but it's an autoimmune disorder, like you said, usually extensive
Hmm.
surfaces, right? And then
Hmm.
contact dermatitis, like poison ivy or certain kind of
Hmm.
metals. So, but good.
Okay.
Questions, concerns about how to work through this?
No, so just instead of, so do you not cross off like that in a way,
No,
or
I would say
you?
this. You can cross off, but I want you to. That's why I said pick your gut first, right? In your mind, you should be like,
Okay.
oh, okay, I like atopic dermatitis. Now let me kind of think about, okay, what other choices I'm gonna start crossing out later instead of crossing out to get to the right answer. Does that make
Okay.
sense? What I'm saying?
Okay. Yes, makes sense.
All right, let's go to the next one and let's go